September is Prostate Cancer Awareness Month, and Dignity Health is offering free screenings, helping men in our area stay on top of their health. And joining us this morning is Dr. Shahzad Siddiqui with why it is so important that folks get screened. Talk to us a little bit about the importance of men kind of taking charge of their health in this way.
Thank you so much for having me. Prostate cancer is very common, so there's about 313,000 people that are going to be diagnosed with prostate cancer this year. It's a leading cause of death from cancer, so about 35,000 people are going to die from prostate cancer this year. And it's very treatable, so those are all great reasons to be aware of prostate cancer.
Are there any warning signs that men should be looking out for, and then if they see those signs, sort of, again, take the bull by the horns and get that screening done?
So most commonly, prostate cancer is asymptomatic. Sometimes, rarely, it'll present with urinary symptoms, things like blood in the urine or difficulty with urination. There are other things more common than cancer that cause those symptoms, things like an enlarged prostate or a urinary tract infection. So if you have symptoms, you should go see your doctor, but it's also important to be aware of screening because that's really the main way we detect prostate cancer.
And who should get screened? Is there an age range in particular you're really focusing in on?
So screening is a bit of a controversial topic. Currently, we recommend shared decision making, which means talk to your doctor about the benefits and risks of prostate cancer screening. The biggest benefit is it helps detect the small percentage of patients that present with advanced prostate cancer. People with advanced prostate cancer live longer with treatment. The main risks of screening are it leads to overdiagnosis. A lot of people with early stage prostate cancer will live a normal lifespan. They'll die of heart attacks, strokes, other things. There's anxiety with a cancer diagnosis, and there's risks from a prostate biopsy and the treatments that we use to treat breast cancer. So it's good to be aware of these risks and benefits and talk to your doctor about screening and do what's best for you personally.
And speaking of screening, we have that event that's coming up this weekend. People need an appointment to get screened. It's very easy to do. Can you talk to us a little bit about the event itself?
Sure. On Saturday, we have a prostate cancer screening event. It's at our East Sacramento Cancer Center. We give people information about screening. We have about 58 people who have appointments, and we also allow for walk-ins.
And it is open to all, not just Dignity Health members.
Open to all, and it's free.
All right. Thank you so much, Dr. Siddiqui, for your time. We appreciate it. Hopefully, folks will take advantage of this free screening.
Thank you for having me.
And there is some information about this event on your screen right now. To schedule an appointment for a free prostate cancer screening, call the number at the bottom of your screen. It is available at the Mercy Cancer Center, and that is on C Street in Sacramento. Back to you, Brandy.